The topic was COVID-19 vaccination, what we need to know. I'm the chairman of emergency medicine at Mercy Medical Center. And again, I thank you for having us today to provide this education to you, and please bring it to your friends, family, and the community. So we're going to go through sort of the who, what, where, why, when, and how, which really the how seems to be the hardest at this point for people of COVID vaccination. So again, as we know, this is an informational lecture. Any specific questions, we'll answer some questions here, but if any individual questions, please speak to your doctor, your healthcare provider for your individual concerns and own healthcare issues that may be related to vaccination. So why vaccines? So we've been dealing with the storm, started March roughly 6th of 2020. We've all been into this together. And what we've learned is as a community, we're all stronger together. So now we have this rainbow coming at the end of the storm. It's just a matter of getting it distributed to us, you, and everyone we know, basically trying to stop the spread and stop us from having to deal with what the COVID challenges we've been dealing with for the past 10, 11 months. So it protects you, hopefully protects your family, friends, and more importantly, and what we've learned is hopefully we're really protecting our contacts. So a lot of the cases we see are benign contacts. Oh, I was meeting up with so-and-so for coffee or in a store. Oh, I invited a neighbor over who I don't normally see, and we talked in the house for a little while, and then all of a sudden that person tests positive and there's a contact. We make our community safer by reducing spread and by making each other healthy, reducing surge at hospitals and ICUs, which improves care for everyone. And more importantly, once you get it, put your sticker on, show it to friends, your family, the community, everyone around you, while wearing a mask, of course. So this is, as we know, CDC puts it out, it's been all over TV. The vaccines are going to be our prime tool in stopping this pandemic. So what's the goal? So how do we control a viral pandemic? And the goal is to get to the herd effect, or basically enough people in the population that have either had the disease or are immune to the disease. So there's two ways of getting there. There's the natural way, which is you get an infection and you recover, or you get a vaccine. So looking at vaccines, you basically look at the effectiveness and the vaccine coverage, and that gives you how effective the vaccine will be to get us to the herd threshold. The good news is that it appears the 2 vaccines available to us so far are actually more effective than 70%, which will help us get to herd immunity with even vaccinating a smaller percentage of the population. So most of the questions come from, does it work? Is it safe? Can it be trusted? Will the mRNA harm me? And we'll talk a little bit about what that is, since that's something most people, and even most people in healthcare, haven't seen in a treatment or in a vaccine before. How is it developed so fast, which is the most common question I think I get from people. Will I need more shots after the first round? Can I take off the mask? Will I get sick from the shot? If I've had treatment already, or if I've already had COVID, should I get the shot? Is it safe? And where can we get more information? How do we get the shot if we want it? So are the vaccines safe? So the priority in vaccine development really was safety. Safety equals trust. If people don't trust it, if you don't trust getting the vaccine and you don't get it, we're never going to get to the level of vaccination and antibody responsive community we need to get to that herd effect and get away from the storm that we've been through. The FDA, most vaccine effects happen in the first 6 weeks, typically even sooner than that. The vaccine actually extended this one by at least 2 weeks for the studies and continues to follow people. So safety monitoring is ongoing. When you go and have a chance to get your vaccination, you'll be offered information about a V-Safe application, where the CDC and government will send you text messages and updates where you can tell them if you're having any side effects. And this is just another way of tracking in real time. And if anybody's having significant side effects, I'm told that you'll receive a call from a healthcare professional to talk about the side effects you're having if it should occur. The good news is the side effects are fairly minor, fairly short-lived, and we'll talk a little bit more about them a little later on. The other good thing is the studies on the Mrna and Pfizer product had roughly 10 times more people than the FDA typically requires for a vaccine safety study. So in the realm of 30 to 50,000 people as opposed to 3 to 5,000. So safety monitoring. A number of these things existed, sort of that alphabet soup at the top with all vaccines prior to the COVID vaccines. What is new is the V-Safe application, which we talked about, and it's basically active text messaging, asking you how are you feeling, and you respond to the text. If there's significant issues, you get a call. So will they work? So we talked about a little earlier on a slide, getting to herd immunity and potential for 70% vaccine effectiveness. In the two studies from Mrna and Pfizer, we're talking over 90%, which is really great for a vaccine. We're talking MMR type effectiveness here, far better than what we get with the flu vaccines. And more importantly, the studies included people of different races, ethnicities, and age groups. And that's probably the most important because we're looking at a pandemic that affects really everyone. So number of people enrolled, 40,000 in the Pfizer study, about 25,000 in the Mrna study. It was a diverse group of people. So, there's evidence that it works regardless of race, regardless of age. In the Pfizer study, about half are 56 to 85 years old, and a quarter of the Mrna study were over 65 years old. So what do they look like? So basically, they're very similar. They're different mRNA sequences. What mRNA is, it's basically a little piece of code, an instruction manual. The Mrna dose is slightly higher. The days are spread out to 28 days between the doses. It appears that you could actually go past the 28 days and still have fairly good effectiveness. On the Pfizer one, it's 2 doses as well. They are separated by 3 weeks or 21 days apart. Both are frozen liquids. Really, the challenges we face in distribution are the fact that the Pfizer one has to be really cold stored, deep frozen essentially, down to negative 94 degrees Fahrenheit for storage if it's up to 6 months. And once it's taken out of that, then you really only have 24 hours to use it, which is a challenge. The Mrna, unfortunately, there's less of it available, but the storage is more common like you store a normal vaccine. You can essentially use it refrigerated for 7 days. So the characteristics, they're both fairly similar, as I mentioned, and the effectiveness is basically the same. What they do is they make a target spike protein. We'll talk about what that is in just a bit. Both require 2 doses. You do need to stay with whichever product you have the first time, you'll get the second time. We'll talk about how facilities who are giving this are doing that. For the facilities and the places giving it, it's close attention to logging all the doses. In New York State, there's actually an online system you'd register with beforehand to get your appointment and to get reminders. Currently, the only ones that are approved or received an emergency use authorization are the mRNA vaccines. There are some other virus vector type vaccines that are in the pipeline. We may see later on in the year. Unclear when those will be out. As you can see, there's vastly different storage and handling, refrigeration essentially versus deep freezers. And the unknowns is there a difference in safety or efficacy. In the studies, there really was no significant difference. Will there be differences in the other ones coming out, hopefully later in the year? That we don't know yet. So why should we trust this vaccine? So the really important thing for everyone to realize is that the FDA, who approves these drugs, really didn't skip any steps. Things were done more quickly. There was more of a focus on it. The standards have remained unchanged for decades of how they review. Priority, however, was different for this. In addition to the FDA, there's 2 independent advisory committees, which were not tied to either vaccine company or the FDA. The word soup's on the bottom, the Vaccine Related Biological Products Advisory Committee and the Advisory Committee on Immunization Practices, who both reviewed the data and gave their opinions to the FDA. So what is an EUA? So an emergency use authorization. Basically, this is when the FDA looks at something and the advisory bodies look at a drug or medication or some sort of treatment and determine that the benefit outweighs the risk and it's needed in an emergency situation, which obviously the pandemic we're dealing with is definitely an emergency situation. It's a shorter process, but all the steps are still required to get to it. It does not imply the authorization was done too quickly. It does not imply any change in safety. So how do we get here so quickly? Prior to this vaccine, the fastest vaccine, I believe, was 3 years. So really there was a global effort. Pretty much never in history has every country, every research body come together and attack one problem at the same time. We used existing trial networks. So there's many research networks. Oftentimes when you're creating something new, you're one company or one group trying to get subjects, get patients to enroll. They use networks that already existed. Essentially, there was unlimited money, resources, knowledge, and manpower dedicated to this. And that's probably the biggest thing in how we got here so fast. There were eager study participants. So one of the hardest parts in any medical research is getting people who are willing to take a drug or a treatment that hasn't been proven yet. But another big step was these companies, largely due to government funding, started manufacturing and having these doses ready prior to the end of the trials. Most commonly, you do research and you study a medication. If it's not approved, you don't start manufacturing. It's incredibly expensive to manufacture these. So there was some risk in manufacturing before knowing that it was going to be approved. The FDA gave a priority basically over everything else while it was being developed, and the production was just done faster because of the technology. It's much faster to produce an mRNA vaccine than is the common vaccines that we use that have typically used pieces of virus or inactivated virus or dead virus that was injected. So how does it work? mRNA vaccine. So think of mRNA like a Post-it note. Your DNA makes mRNA. This vaccine contains basically a little set of instructions, a Post-it note with instructions on it. Read me, build the spike protein. And then when you're done reading those instructions, the cell essentially crumbles it up and throws it away. It does not contain any of the COVID virus itself. You cannot get COVID from mRNA. mRNA does not alter your DNA. The list of instructions does not include the instruction for getting into the nucleus of a cell where the DNA exists. So again, COVID vaccines will not give you COVID-19. So I want you to all take a look at that picture. That's sort of a model of the coronavirus. And what the vaccine does is it tells your cells how to build those little red spike proteins. Those proteins in and of themselves are not dangerous. They're sort of the key to get you this virus into the cell. The instructions for the virus to reproduce, to harm you, are contained inside the cell itself. No part of the cell is included in the vaccine. So mRNA research started about 10 years ago or so with cancer vaccines with some success, CMV, retinitis. They started studying it for Zika and rabies. Again, there wasn't that worldwide focus and resources dedicated to it yet. So the good news is that the mRNA does not stay in your body. It's actually rapidly destroyed once it's used. Again, it's an instruction manual and it only builds that spike protein. What it does is it triggers the immune system to recognize the spike protein. Anything that's foreign in the body, the immune system reacts to. You build antibodies to identify and attack it. That's the first step. So getting people antibodies. Once the antibodies are built, the next step is basically the body using its other cells, what are called memory T and B cells, to recognize, destroy the foreign object, and more importantly, learn from it and create memory so that if you ever get exposed again, it knows what to do and how to attack it and protect you. So again, talking about that spike protein, it's like your cells are a lock. They don't want that virus in it. They don't want anything in it. However, the spike protein is the key. So what the vaccine does is essentially let you build an antibody that then blocks the teeth on that key so it no longer can open the cell to let the virus in. And more importantly, it sends up a red flag to the immune system, letting the immune system know there's something foreign here. We need to contain it, attack it, and not let it into our cells. So are there side effects? One of the biggest concerns is what's going to happen to me if I get this shot. Yes, there are side effects. The most common in, I think, pretty much everyone that's gotten the shot at this point is having some arm soreness. As you all know, this is very common with most vaccines. It's due to immune response. You see with tetanus shots, you see with the flu shots. Now that should not be a game changer. Less commonly, and we see it a little more in people who've had COVID before, some fatigue, body aches, chills, essentially flu-like or COVID-like symptoms. The good news is they're very short-lived. Most people have them for a day or half a day, and then that passes. People who've had prior COVID and people who haven't had prior COVID who are getting their second dose do seem to have more of that flu-like reaction. Again, not so much like flu or COVID in the fact that it really resolves after about, at the most I've heard at this point is really a day. Immune response is the goal. That those symptoms are due to an immune response. It's your body revving up the immune system, sending out the fire trucks essentially. What about the allergic reaction? So these have been in the news. A couple of people did have severe allergic reactions. And the belief is that it's due to what's called PEG, or polyethylene glycol, which is essentially the vaccine manufacturers had to figure out a way to get the mRNA, the instruction manual, into the cell itself. The problem is if you can't get in the cell, it just gets destroyed in the body and the instructions never get to the factory essentially to be used. So they put the mRNA in lipid or fat particle, which is pegylated, has polyethylene glycol on it to help entry into the cell. PEG is not new. It exists in a lot of products you use on a daily basis, shampoos, toothpaste, a couple of laxatives. What's important to know is anaphylaxis or severe allergic reaction is actually fairly rare with vaccines. It occurs in about 1 in a million doses. Basically, we're going to talk a little more, but patients with prior allergies do have to be aware. So prior allergies to other items, even severe allergies, you have to be aware of them. That does not preclude you from getting the vaccine. Also, the FDA recommends, and the vaccine sites, they've been doing it. If you have no allergies, at least a 15-minute observation period after you get your vaccination. If you do have allergies, at least a 30-minute vaccination period, because this generally happens fairly quickly after vaccination, if it's going to happen. So who is precluded from getting the vaccine? So if you have an allergy to the vaccine itself or a specific component of the vaccine, then they recommend not getting it unless approved by an allergist or immunologist, and to get it in a setting with advanced medical care. So if you get your first COVID vaccine and you have a severe reaction, you shouldn't get the second one. If there's an immediate allergic reaction to previous doses of the vaccine or any component, so again, if you've got the COVID vaccine and have a severe immediate reaction, shouldn't get the second one. The only other allergy is to polysorbate. If you have an immediate severe reaction to polysorbate, there is some potential cross-reactivity. So individuals dealing with those issues should talk to an allergist, immunologist, their primary doctor, before considering the COVID vaccination. So how does the process work? Again, 2 doses. Pfizer's study was done at 21 days apart. Moderna's study was done at 28 days apart, with essentially no significant difference in how the vaccine provided protection. Maximum protection is expected at 2 weeks after the second dose. There are some people who were in the studies who were lost to follow-up, couldn't complete the second dose, and did find that those people did have slightly more protection than those who were unvaccinated. So there's some theoretical protection that starts even after the first dose, not anywhere near the 90+% we talked about earlier after 2 doses. Will this be a recurring shot like flu? At this point, we don't know yet. Many of the study participants are still being followed to see how long their antibody response and immunity lasts. Once we see how those people in the study did, we'll know more about how often this needs to be done. How long are the antibodies effective for? That, again, also we don't know. We know after COVID virus, many people do lose their antibodies after 90 days. That doesn't mean the immune system can't respond. They just know how to respond, again, because we talked about those memory cells. But again, this is still fairly new. It's only been going on for the past year. So we don't know what the duration is yet. The most important thing is you have to get the same product for both doses. So if you get Pfizer first, you got to get Pfizer the second time. If you get Moderna first, you got to get Moderna the second time. So Pfizer could be given to anyone 16 and up, Moderna 18 and up, and that's really just how the studies were done. That will likely eventually expand into pediatrics. If you've had any other vaccinations or planning vaccinations, there should be a 2-week interval before and after the COVID vaccines. They don't recommend mixing the vaccination periods. If you've had prior COVID or dealing with COVID now, you must be recovered from it. If reinfection isn't common in the first 90 days, so there's a lot of people who say, wait 90 days before getting the vaccine. You do not have to do that, but reinfection is uncommon. So if that's the case, waiting 90 days wouldn't be a harm. And they say people may delay the vaccine, but really there are a few cases of reinfection. You get a more robust response after the vaccination as opposed to recovery from infection. So this is one of the situations where the vaccine it's a 1 + 1 = 3 situation. However, if you've had COVID and you received antibody therapy or the hour-long infusion, which a number of hospitals, including Mercy, are doing for individuals with COVID, if you did receive antibody therapy, you do need to wait 90 days because that antibody therapy could make the vaccine not effective. People with underlying conditions. So those who are immune compromised, really that depends on talking to the specialist on why you're immune compromised. So your oncologist, if it's because of chemo, if you're on chronic steroids for renal transplant, COPD, chronic obstructive pulmonary disease, then talk to a specialist. Most of them are still going to recommend, because being immunocompromised does put you at higher risk of severe complications from COVID. Autoimmune disease, you may receive the vaccine. Again, recommend talking with your specific provider. One of the concerns with flu vaccines is people who've had Guillain-Barré before, which is essentially a neurologic condition where the nerves get inflamed and you can actually have temporary or prolonged paralysis from it. That is not a contraindication with this vaccine. There's no cases of it in the studies. And again, the vaccine works by a different mechanism. Egg allergies, egg is used in a lot of vaccines for production. Egg is not used at all in the production of the COVID vaccine. There was in the news some cases of Bell's palsy that occurred with people who had COVID vaccine. When the FDA looked at that, it looked at like the cases did not occur more so than they would have in the normal population. So if you've had Bell's palsy before, that's also not a contraindication or a reason why you couldn't get it. Pregnancy and lactation for family members. So the risk is unknown, studies are pending, and it's because pregnancy is a special population when you do research and requires different approvals. What we do know is COVID in pregnancy is far higher risk, much higher risk of complications, hospitalization. Basically what they say is it's the mother and the provider's choice. You may choose to be vaccinated. As far as breastfeeding or lactation, it's not thought to be a risk to the infants at all. Can we take off the masks? That's one of my little ones, I should say. Until herd immunity exists, masks are still going to be needed. So I know they're annoying. Trust me, I wear them for 12 hours at a clip. For now, we still need to wear the masks. One of the questions is, are you still able to carry or spread COVID despite vaccination? That part is unclear. We don't know yet. We know the vaccine efficacy is that it protects you. We don't know if you can have the virus in you and potentially spread it to other people. Most of the time with viruses and antibodies, the antibodies bind it and essentially make it ineffective. So you shouldn't be able to, but again, that piece has not yet been studied. So the government, a couple of national academies wanted to figure out a plan while they were developing these vaccines on how we're going to get these to people. So the initial plan developed a couple of different groups, frontline healthcare workers, home care workers, home health, emergency services, older adults in crowded settings, i.e. nursing homes or assisted livings, and then the people who are most at risk. In that initial order in the first group. And really that's because those are the patients at most risk for exposure or most risk of complication. So currently, as of this week in New York, basically anyone over 65 is now eligible, in addition to everyone on the list: dentists, healthcare workers, pharmacists, pharmacy aides, group living facility, residents and staff, teachers, childcare workers, first responders, basically anyone with a public-facing job who potentially at risk. That being said, there are some challenges to that. So for those who are familiar with QR codes, you know what to do. There will be one or two that have information for you if you want to use it. But basically, if you're not familiar, open the camera on your phone. There'll be one coming up and another one at the end for links for scheduling and eligibility information. Basically, you just hold your phone camera up to it and a link pops up at the top for you to click. So am I eligible? How do I sign up? So couple of websites there. New York City setting up mass inoculation sites. There's sites opening at Jones Beach, a couple of other areas. I think just about every hospital has a pod. And then us here at Catholic Health have a website with frequently asked questions and a link as well. And there'll be a QR code for you to scan at the end. I'll leave that up. So outside information, there's information from the CDC, New York City, Nassau County, a number of different links that you can take a look at. And then how do we beat COVID? So again, herd immunity is really the key to beating COVID at this point. And we get there through vaccination and those who have had infection and recovered. Most important thing is consumer patient confidence and trust. So how do we develop that? How do we get people to be willing to take the vaccine? By showing it's safe, explaining to people why it's safe, that it works and it's effective. Again, far more effective than the flu vaccine, and providing education through our sessions like this. We're always here to help. The ER is one of the things we do note is, people still seem to are trying to avoid the emergency rooms. We isolate people at risk. We screen people as soon as they walk in for symptoms or risk factors, try to isolate them separately. The emergency departments throughout Catholic Health are safe, and we are here for you if you ever need us. Hopefully you don't, but we are here if you need us. I'm going to leave this QR code up while we answer any questions. This is a link to some frequently asked questions. And on that page is also a link to the New York State Department of Health website, where you can you enter your information, find out if you're eligible, and you can look at sites that have open vaccination appointments. One of the big challenges in New York, with everyone on that list that we talked about before that's eligible to receive vaccines, is basically there's 7 million people in New York that are now eligible for vaccination. New York State receives roughly 300,000 doses per week. Each person needs 2 doses. So it's going to be, there's going to be a while before there's enough vaccine available. There's staff available. The hospitals, these mass vaccination sites are ramping up to get it to everyone who needs it. It's really a matter of how much we can get from the federal government to give to New York population at this point. Again, thank you for having me. If there's any questions, I'm going to leave this up while we talk, but please do ask.
Yeah, question. We've been spending the past 3 days trying to get through to New York State, Northwell, Nassau County to get vaccinated. The earliest we've been able to get is March 5th. We found a friend who was able to get through Hillcrest High School in Queens this Sunday, and this was yesterday. New York City is not allowing non-city residents to use their facilities. Is there any way to, and the further on this, once we get the first shot, are we going to have to will we automatically be notified for our second shot?
Okay, so both very good questions. I'm going to answer the second one first because that one's a little easier. As far as this first and second shot, so wherever you get your first shot, it is that place's responsibility, and they are, once you get the first vaccine there, they are tagged for delivery to receive second doses for you of the same product. So the New York State mandate is that any place vaccinating is to be telling you when you're supposed to come back for that second shot, and opening appointments up, or just telling you to show up on whatever that date is, the 21 or 28 day, depending on which product you get, and bring you back in. So when you get your first shot, it is the responsibility of those giving the first shot to bring you back in. In addition,
that's a New York State shot site, Jones Beach.
At Jones, so the New York State website, when you register, they should also be sending you email notifications. I believe there's an option for email or text when you register.
Yeah, we did that.
Everyone does need to go through that New York State website, which I know has been incredibly challenging, and this leads to your first question. New York City is doing things, they're doing things their way. And it does appear that they've limited to New York City residents. There is going to be a challenge until the government ends up giving New York State more shots, basically more doses per week, about getting appointments. So as I mentioned, most of the hospitals, or I think every hospital at this point, set up vaccination pods, has scheduled staff for it. It's a matter of getting the doses. So the allocation currently from the government, which is a challenge because we want to get it to everybody, is 300,000 doses a week to New York State, which obviously is not nearly enough when we're talking about 7 million people who are currently eligible, and that's not even opening up to the general population yet. So trying to get everybody in, the state sets the schedule, puts those dates out. The link from this QR code to the CHSLI COVID vaccine information brings you to that New York State website as well, and basically lists every site that potentially is giving vaccines. We expect to have more at each of our facilities as the allocation goes up, but it's been as frustrating for us in the healthcare field as it is for each and every one of you trying to get people in. I've been trying to get my mother an appointment as well, but since it all has to be done through the state, there's not even like, oh, we'll just come in and show up and maybe we can get one.
By the way, it doesn't list all the sites because the New York State only lists the sites on Long Island and one in the Bronx. If you want to see Javits Center, for example, you have to change the address up at the top to Jacob Javits, 100 miles from Jacob Javits. Then the Jacob Javits Center comes up.
Yeah, you have to expand out the window on it. And like I said, New York City is limiting to New York City residents, which I don't know how they divide the allocation from the state to counties. But I suspect based on the population, they're probably getting significantly more doses.
Excuse me, if you're going to a drive-through location like Jones Beach, can someone drive you? Can you have someone drive you, or do you have to go yourself?
Can't make it.
It is my understanding you can have someone drive you there.
Was exposed to COVID.
Obviously, they would not be able to get it unless they're registered and eligible. But it is my understanding, just like with the testing, you can have someone drive you. If it's someone from outside your household, as with everything else, they do recommend both of you wearing a mask.
Thank you.
I have a question. Is there anything you should not be taking before or after you get the vaccine? Like, should you not drink alcohol or take Tylenol? Is there anything that will lower the effectiveness of the vaccine? So
alcohol theoretically can limit the effectiveness of any medication, including vaccines, because it does lower the immune response. There's some theory about Tylenol or Motrin potentially lowering the immune response to the vaccination. However, none of that is proven at this point, and people in the study were not restricted from taking those medications. So the data in the study, and I would suspect that many people did for their arm soreness or for the sort of flu or COVID-like symptoms for the day. I know when I got mine, I was sore and had chills the next day and took Motrin. So I wouldn't say that precludes it. If you don't need to take it, by all means, don't. But there's many patients who we see who, if you have arthritis or other painful condition, that if you're not taking your Tylenol or ibuprofen, you may not be able to get out of bed to get to the vaccine site.
I have a question. Yep. You had said if you're already scheduled for a vaccine, will they send you something beforehand? Is that what you're saying?
That depends on the site. I don't know if all the sites are sending out email reminders, but if you went online and registered, you should show up for when you registered. Most of the sites that I know of are sending an email reminder afterwards or a confirmation. But if you were able to register for a site online, then you should have that appointment.
Okay.
Hello.
Thank you.
Hi, my husband is a teacher, and I've been trying for a couple of days now. I've tried the Nassau County, the Suffolk County, the New York State sites. I keep refreshing, and I can't get him an appointment anywhere. Jones Beach is full, Jacob Javits is full. Can't get to Hillcrest High School, where I know a lot of people have been going. I've been trying Brooklyn, Staten Island. What do I do?
Unfortunately, at this point, you're doing all that you can do. Like I mentioned, it's a great question. It's the most frustrating thing for us as healthcare providers, because we want to get these doses out as quickly as possible to as many people as possible. Basically, the state's allocating sites and appointments based on where they're shipping the allocation that comes into the state. When they know they're going to be shipping to a specific site, say Mercy Medical Center, they open appointments they give us appointments for that site, and we provide staff for it. Unfortunately, due to the limited allocation. What's that?
Are more sites going to be opening?
I suspect both more sites are going to be opening, and more appointments for the sites that exist will be opening as more doses get allocated to New York.
Okay, thank you.
Really, like I said, the staff is there, the facilities are there, the supplies are here. It's really just getting more vaccine from the government, because the federal government's allocating to states. So it's really just trying to increase that share. I know both Governor Cuomo, Mayor de Blasio put out a statement yesterday, basically asking, demanding, begging for more allocation to New York State.
Thank you. Thank you for what you're doing.
Thank you.
Dr. Bramante, I have a question.
Sure.
So we're hearing about all these different strains of the COVID virus. So just like the flu virus, every year there's different strains and they do whatever. Does that vaccine, is that going to cover us on all the different strains that we're hearing about right now this year? Or is there a different, what can you tell me about that?
All right, so we'll talk about the biggest strain that we're hearing about, because it already exists in the United States and on Long Island, is the UK variant, or the British variant that was discovered. The good news is, well, that one does appear to be more infective, meaning easier to spread. The good news is the spike protein appears unchanged on that. So Pfizer has put out a statement that the vaccines should still be effective, since the target is the spike protein. So that one, the statement is that it shouldn't change anything. There's another variant initially in South Africa and Brazil that they're looking at. Again, doesn't appear the spike protein has changed, but I don't have information yet to really comment on that. However, as long as the spike protein doesn't change, the vaccine should still work.
Okay, thank you.
I have a question. If you get the first vaccine and you schedule yourself for the second, either 3 or 4 weeks after, are you pretty much guaranteed of getting that second shot? I've heard that New York might run out of the vaccine.
So that's definitely a concern. It's definitely a real concern. The state is saying, so initially facilities were giving the first dose and holding a dose basically in refrigeration, waiting for you to come back, which obviously slowed down people getting their initial doses. The most recent statement and what the practice is get everyone their first shot, because it is tracked through the state website. They know which facilities, which sites need second doses and of which product. And that the statement is that the doses will be there. there's a little bit of trust from the healthcare community and from the patients as well of the state to do that. We expect that to be the case since it is being closely tracked and monitored. And as you know, when you try to get an appointment, the appointments are fairly limited, which we've heard quite a bit of from the questions today. And part of that is because the fact that the state has to plan for where the doses are going and getting people their second dose. The good news is there's more and more evidence coming out that should the second dose have to be delayed, whether because of dosing, most commonly it's because somebody gets sick or has COVID-like symptoms or even can get COVID between the two doses, and you have to delay that second dose, that the effectiveness doesn't go down. Essentially, it's like a booster shot as long as you get it in some sort of timely fashion, not a year or something later, but at least a couple of days or potentially even a week or two later does not seem to be an issue.
Thank you.
I have a question. I know people, I thought you said that only New York City residents can get the shot, and in New York City, I know people from out here who've gone into the city and gotten the shot. So how does that work?
I don't know if the New York City is actually restricting it. I don't know if there's just no appointments available because they've booked up so quickly.
They are. If you fill out their form,
The Hillcrest, the Hillcrest site.
this is for the Hillcrest site, which is in
Mhm.
Queens. If you fill out their form, one of the questions is, do you work or live in New York City? Next question is, I certify that I live or work in New York City. If you say no to both, when you finish filling out the form, it says you're not eligible.
Right.
I said, I don't live or work in New York City. And then I said yes to certify, figuring I'm certifying that I don't live or work in New York City. When I filled out the form, down at the bottom, it says you're ineligible.
Right.
Okay.
When you said that you do live in New
This
York
is
City.
like I mentioned, this is a frustration for
then they
all
can
of us.
be
And
eligible.
honestly, I can't comment on what the New York City rules are or how they rolled it out.
I know, I
at
was just
sites.
saying.
But again, I know every physician, every healthcare provider wants to get as many people in as possible. And we're working with what the state gives us. And we hope to get as many appointments scheduled and get more allocation so we can get those slots opened and get you registered to get everybody in.
Okay, the pharmacists in New York City seem to allow you, and they don't have any vaccines, but they don't say you're ineligible. It's the super sites like Hillcrest that don't allow you to register to make an appointment if you're not a New York City resident
Or worker.
or worker. Yeah.
Well, Okay, so
I have
just-
a question.
Okay.
I'm sorry. You said if you had a reaction to the flu vaccine, it's not recommended. I've only taken the flu vaccine twice. First time I took it, I was absolutely fine. The second time was last year, and for 4 days, I didn't feel well, and my chest was heavy, and I almost felt like I had a flu. So I was wondering how what are the parameters of a reaction to know how much of a reaction where you shouldn't take COVID vaccine?
Yep. So great question. I do want to clarify having a reaction to the flu vaccine does not preclude you from getting the COVID vaccine. The components are basically completely different. If you've had severe reactions to any allergen in the past, it's something to be aware of, but that's why they built in, again, that sort of body aches, myalgias, chills reaction is really an immune response to the flu vaccine. That's not an allergic reaction. If you've had a severe allergic reaction, that's why they built in the monitoring period of 15 to 30 minutes after you get the shot. As for those who are not eligible, if you've had a severe reaction to the COVID vaccine, basically if you've gone to first round and you had a severe allergic reaction or an immediate allergic reaction, you should not get the second round. Those are the only people who are really precluded from doing the full vaccination series. And people with a polysorbate allergy.
What is
Luckily, it's
polysorbate?
fairly rare.
What is polysorbate?
It's basically a preservative.
You have
in the COVID vaccine,
mentioned-
but there's cross-reactivity.
You have mentioned antibody therapy with transfusions. What is that you're talking about?
So it's one of the therapies that was approved again under an emergency use authorization by the FDA probably about a month or two ago now. We heard about it. President Trump received the Regeneron product, which is a polyclonal antibody. Most commonly in this area, people are getting bamlanivimab, which is a monoclonal antibody, and it's basically for patients who meet specific high-risk criteria and are COVID positive in the first 10 days of symptoms. However, they have to be early enough in the infection where they have mild to moderate symptoms. So if you're sick enough where you have to be hospitalized, unfortunately, by that point, the antibody infusion doesn't work. So for those who are basically anyone over 65, patients with diabetes, hypertension, diabetes, chronic kidney disease, immunosuppression, those over 55 with coronary artery disease or hypertension, put you in high risk categories. If you have a positive COVID test, you can, I believe all of the Catholic health sites at this point and a number of other hospitals receive an allocation of monoclonal antibody and polyclonal antibody that you can, if you meet the criteria and don't need to be, and are not are early enough in the infection where you don't need to be hospitalized, you're a potential candidate to receive. It's an hour-long infusion and then a few hours of monitoring after it. They recommend at least a minimum. We've been doing a few hours of monitoring to make sure there's no reaction to it afterwards.
As far as those risk factors, I know in phase 1C, you are eligible if you have one of the risk factors. When you go for the vaccine, do you have to show proof of
So they
having
haven't
one
given
of those
guidance
risk factors?
to us yet on what you'll have to show. What I'd recommend at this point is speaking with your doctor and receiving, trying to get documentation of what your risk factor is. This way you have it, because I suspect they will require or ask for, some sort of letter or something saying that you are, 45 and have diabetes, hypertension, and immune compromise, or you're 75, well, 75 you're already in, or 64 and you're on chemotherapy, so you should get the vaccine. They haven't given clear guidance on what that next phase will look like. And I suspect that next phase will probably be delayed in opening as we're still trying to get most of you who are in this phase vaccinated.
Should you have a COVID test prior to getting the vaccine to be sure you don't have it, haven't had it, don't have it at the time? If
So
you could be asymptomatic and not know.
So you only need a COVID test before getting the vaccine if you're symptomatic. In theory, people in the study could have been asymptomatic carriers as well when they got their doses. The biggest thing, you could vaccinate somebody while they have COVID. The main thing is that you're supposed to be quarantined and not bringing it into other people who are not protected already or into the vaccination site. That's why if you should by some chance develop COVID between the first and second shot, they recommend delaying the second shot until you're out of your isolation.
For the second shot, is it going to be this several week way to get the appointment like for the first one, or is there some kind of priority list for second shots?
So as we mentioned, the site where you get your first shot is supposed to schedule you or tell you what day to come back. I know here we're basically telling people on day, whatever, if you had your shot last week or whatever the date it was, and say your next date's February 2nd, we tell people just show up anytime on that day to get the shot. And we have a vaccine pod just for people getting their second shot.
Okay, I just want to mention, Dr. Bramante, we're gonna be putting this PowerPoint on our website at Mercy Hospital, and we're also going to be putting it on St. Joseph Hospital, and I know Lisa is going to be putting it too at the JCC. So if you want to look back at some of the things Dr. Bramante said or anything like that, correct, Dr. Bramante?
Correct.
Okay. And
we have a house upstate. I'm sorry, we have a house upstate. Would I be able to get a vaccine over there or only in my own area? I know people are looking all over, but I wasn't sure upstate if it's any different.
That I don't have a great answer for. The New York State Department of Health website does have contact number as well. On the slides, there was a contact number as well for the Department of Health regarding vaccines. That could probably better answer that question.
Thank you.
The contact number is useless. They can't answer it. They say Due to increased volume, we can't take your call at this time. Please call back later. And this was at 7 o'clock at 8 o'clock in the morning.
No, it's 5 o'clock in the morning.
But they
No,
didn't
it's
open
se-
yet.
No, it's 7 o'clock, yeah.
You know, the moment they opened, they couldn't take
You
your
good,
call.
Lisa?
Yes,
Okay, so-
I just want to thank you both so much. Thank you,
Thank
Dr.
you.
Bramante.
Listen, I want to thank Dr. Bramante because unfortunately we had this planned and we definitely made sure that we had someone that was very versed and educated on all of this. Dr. Bramante is wonderful. He runs the ED here at Mercy Hospital. So honestly, which is a safe environment and everything else, and we do everything for our community. So Dr. Bramante took time out of his day to make sure that he made all of you aware of and educated and that we could get this out to everybody in the community. So Dr. Bramante, thank you so much.
Thank you for having me. I want to thank everyone who joined in to listen today. And again, you know, take the information, share with your family, your friends. It's been a challenge getting the vaccines out there. We will get there as a country.
If we survive.
Thank you.
Thank you so much. Thank you,
Dr.
Lisa.
Bramante. Thank you, Lisa.
Thank you so much. Thank you, everybody. Stay safe.
Thank you.
Thank you.
Lisa, what are we supposed to do with that picture we took of that graph? What is that graph supposed to mean? The one they had,
I
they
don't know
said
what you're
take a
talking about.
picture of it.
Oh, that thing was a,
Oh, it's a grid. You take a picture with your cell phone and it links you up to their website.
yeah,
Oh,
I did it, and it comes up, when you hold your camera up to it,
You scan it with your
Health
phone.
Services Long Island website.
Oh, because I took a picture, but nothing, I didn't see anything.
You don't take a picture, you just hold it
No,
up.
you hold it up with
Oh,
your
too late.
camera and it scans it. But you know what? We're going to have the recording up online and you'll be able to, you can get it that way as well.
Oh, because I didn't know. I just took a picture. I didn't realize.
Yeah, or you could just search, you could search the website. I can forward it to you, Judy. It's not
Okay.
a problem.
Thank you.
Okay. All right. I hope everybody got some useful information and yeah, if anybody has any questions, just let me know. And if you want me to forward the video recording to you, I can do that as well.